Today I am going to talk about arthritis and joint replacement. Arthritis, the most commonest among them is osteoarthritis, which happens due to old age, which is commonly seen in the knee joint in Indians. So for which at an early stage it can be treated with some exercises, lifestyle changes, as well as some medications. And in a moderate stage also it can be sort of managed with medications, with some supplements, exercises and some braces. And at a severe stage it has to be operated. Operation would mean a total joint replacement. Total joint replacement is one in which we replace both the sides of the bone in the joint. In the knee it's the thigh bone as well as the leg bone. The thigh bone and the leg bone end of it will be replaced with an artificial implant. And in between there will be a spacer, we call it as a spacer, in which it will be a polyethylene. So the patient will be made to walk the same day after the surgery. Normally the patient stays in the hospital for about 5 to 7 days in most of the hospitals when a single knee joint is done, and a few more days when both the joints are done together. In our hospital we have started doing knee replacement as a day care also. Day care would mean the patient gets admitted in the morning and gets discharged in the evening. This can happen if the patient is medically fit. If the patient has any other medical issues, then we won't be able to send the patient the same day. But the patient normally goes after 48 hours in an unilateral knee. Unilateral would mean a single knee, and in a bilateral, that means that both the knees are done together. The patient can go home in about 4 days' time. The patient will be made to walk the same day after the surgery. That means in the evening of the surgery the patient will be walking a little, and the next day the patient walks more, and simultaneously some physiotherapy exercises, that is knee bending and thigh muscle strengthening exercises, will start. These exercises go on even after the patient goes home. These exercises can go on up to 4 to 6 weeks, so until we get the full range of movements in the knee joint. And the patient is relieved of the old pain which he had immediately, but the surgical pain will remain for a few days, and with the knee bending it will remain for a few more days, and it gradually keeps getting better. And at 1.5 months the patient is comfortably walking without any support. And this improvement keeps on going until a year's time, and at 1 year is the period where the patient gets the maximal benefit. Thank you.